Swadikap, and good afternoon once again. Today is Wednesday, the 14th of July, 2021, and this is the English language summary of the daily press briefing here at the CCSA. I'd like to start off first with the world situation, as summarized by Dr. Pisamai just now, that many countries around the world now are seeing another wave of the spread. A report on the 6th of July revealed that the Delta variant has spread to 104 countries around the world already, making the number of infections worldwide soaring up and increasing. So you see on screen now the different span of the variants, Delta, Alpha, Beta, and you can see that most of the variants are a risk for Thailand as well, and the region, the ASEAN region as well. So this is courtesy of the World Health Organization for the month of July on the four most dangerous variants that we have today. I'll start off now with the information about vaccination. So firstly, on the 13th of July, as of 13th of July, yesterday, we inoculated 322,488 doses of vaccines, increasing the cumulative number of vaccinations to over 13.2 million doses in Thailand now, over 13.2 million doses. Now, for the vaccines, of course, priority will be given to the elderly, as we mentioned, as the adjustment in our strategy holds in the next 1 to 2 weeks to prevent further spread of the virus, prevent further fatalities, and prevent severe symptoms. For the new confirmed case that we have for today, we record 9,317, as you would see on screen coming up soon for you. We have new recoveries at 5,129. We have the active cases still currently being treated at 99,511. So almost touching 100,000. You can see that on screen. For the fatalities, we have recorded 87 new fatalities with the median age at 71. Bangkok, as usual, has the highest fatalities at 55 fatalities. And for Bangkok, over 70% of the number are people more than 60 years old. So fatalities have a very, it affects, this virus of course affects the elderly to a high degree, to the point of losing their lives. So which we would have to express our sincere condolences as always to the families of the deceased. Now, for the overall situation in terms of the provinces, the area with the highest number of new cases remains to be in Bangkok. We have up for you on screen right now a progression of the different provinces, as well as the list of the provinces that have the highest number. So you see now 2,332 new cases in Bangkok. And other provinces, mostly those nearby Bangkok, the vicinity of Bangkok, the central area, as well as usual, provinces in the southern region of Thailand. And in these areas, new clusters are still found in various markets, factories, and campsites. Now, for the dark red zone provinces, that has increased to 16 provinces. We have this map coming up for you. The progression for each day in the past week, and the rightmost map is the most. The number of green provinces with a few infections are getting smaller. The number of white provinces with no new infections at all has disappeared. So every province has been having new infections. Now you see the dark red provinces. On screen you might see dark red and then orange. The dark red provinces in terms of the infections have begun to increase But these provinces have not been categorized yet as the new dark red provinces aside from the 10 already. This is dark red according to the situation of infection. So we have 16 provinces which have infection rates in the category of dark red. As you see on screen, and the extra 6 provinces, you see that dark red is 10 in terms of the categorization, but now we have 6 more provinces with situations similar to the other original dark red provinces. Now the extra additional 6 provinces here have not been categorized as the maximum controlled area or dark red, but of course in these 6 provinces we have to be very cautious and very vigilant so that the numbers will not get higher and they will not be categorized in a more permanent way in the dark red zone provinces. Now in the dark red 10 provinces, note that the various shops and different kind of services within malls or within community malls. Now those have already been closed, but if they were standalone shops, they would be open, of course, but with the you have to check with the various authorities as well. Now for the shops selling clothes, shoes, garments, as well as pet shops and salons, if they are in shopping malls, they would be closed, but if outside, they would not be. The dentists and beauty clinics are also temporarily closed, along with car wash and dry cleaning. Now, I'll go back to Bangkok a bit. Firstly, regarding the vaccination of Bangkok. So firstly, Bangkok, to date now we have vaccinated 43% in Bangkok, with the target being 70. The efforts are continuing rigorously to reach the 70% target of vaccination in Bangkok. So in the capital city, monitoring 130 clusters, and there are now 69 teams of rapid response missions, rapid response teams. These teams are called the COVID-19 Comprehensive Responsive Team, or CCRT, and 69 of these teams have been created, and they will be visiting various communities to increase the active case finding starting tomorrow. So the active case finding missions will be maximized further in Bangkok. You might have heard of the news about the antigen test kits, or ATKs, for home use, which the Ministry of Public Health has announced that it will soon be available for purchase in terms of the household use for home use. This is in the pipeline, still to be finalized soon. There must be made sure that the highest safety levels for the people are ensured. So this is coming soon. It's something that we expect to coming soon, but just be patient, and we will have those test kits of use in a more widely used kind of way, which will be helping in terms of the testings, which of course we have a lot of testing sites, but most of them are crowded at the moment. So this will be something very good, very good development in due course. Now about the management of vaccine donations from abroad. The government has rolled out vaccine management plan for the 1.5 million Pfizer doses and the 1.05 million doses of AstraZeneca from Japan, as received from the US and Japan. Now, these vaccines will be prioritized for the elderly and for those who have the 7 underlying diseases, people who need to receive either types of vaccines before traveling abroad, such as students and sports persons, as well as foreign nationals living in Thailand, especially the elderly and those who have underlying diseases. Now, we recapped about this a few days ago already, that these vaccines will also be available in terms of supply for the foreign nationals as well, but foreign nationals in the elderly group and foreign nationals in those who have underlying diseases group. Also, frontline medical personnel who treat COVID patients will also be receiving the booster dose from this supply. So the English language audience might be interested in the Samui Plus program. As you have seen in the news, they'll be launched very soon this week and on the 15th. And courtesy of the Tourism Authority of Thailand, we have some information for you there on screen. You can find that on their social media. So this since will be open soon, tomorrow, just to recap some of the measures set to be implemented for Samui, Got Tao, and Phangan as well. So for those who want to enter Samui Plus program, they must travel from 69 low and medium risk countries or territories no less than 21 days before the departure date. And travelers are required to have the documentation, paid or prepaid confirmation of hotels under the Samui Extra Plus program for the first 7 days and proof of reservation of hotels under the SHA Plus for the latter 7 days. And traveling from Samui to other provinces will require proof of staying in Samui for at least 14 nights and 3 negative results of RT-PCR. Upon arrival, undergoing the test and waiting for the results at the hotel room. If the results are negative, travelers will be allowed to carry out activities in the hotel area for the first 1 to 3 days. For day 4 to 7, travelers allowed to travel within the Got Samui district within a sealed route and will have to undergo the second RT-PCR test at the hotel on days 6 and 7. For days 8 to 14, travelers will have to check in and wait for the COVID test result at the SHA hotels. If the results come back negative, travelers will be allowed to travel within Got Samui, Got Tao, and Got Phangan. And travelers also have to install a tracking application and leave the tracking system turned on at all times. So before closing, just to mention that according to the World Health Organization, this week is World Mask Week. The infographic you see on screen highlights how to properly and safely wear medical face masks. This, of course, week would stress the importance of all of these measures: hand washing, wearing face masks properly, covering nose, mouth, and chin. Additionally, underlining that the wearing of masks alone does not prevent COVID-19 infection. So everyone must also observe social distancing and other measures continuously, even until today, and frequently wash hands even though you're wearing a mask. So please be very mindful of that. So this wraps up the briefing for today. Thank you for your attention. Have a great rest of the day and great week, and we'll see you next time. Sawadee krap.